Hi, my name is Jen. I'm a counselor in the state of Michigan and North Carolina, and I help women with perinatal OCD, also referred to as postpartum OCD. The Our country has done a wonderful, wonderful job at raising awareness for postpartum depression, and most OBGYNs will screen women for that, right? In the hospital and at their 6-week checkup. However, we need to talk more about perinatal and postpartum OCD. There are a lot of hormonal changes that happens when a female gives birth, and it can cause an onset of OCD symptoms even if a lady has never had OCD in the past. Postpartum OCD involves upsetting and unwanted intrusive thoughts, images, and repetitive impulses. It produces anxiety. A person may engage in repetitive behaviors, which we call compulsions. These compulsions may offer temporary relief, but it doesn't produce lasting results. We think this is a mix of hormonal and medical factors that causes this, but here are some common obsessions that women will have after childbirth. Fears of harm and contamination coming to the baby, fears around poisoning intentionally or unintentionally the baby, fears that the baby will stop breathing, fears that the parent may harm the baby. Now, a lot of new moms will occasionally have that fear, right? We've all heard of SIDS. We're worried about the baby. We don't want the baby to sleep on the belly, right? However, remember with OCD, these are upsetting, unwanted, intrusive thoughts that repeat repetitively over and over and over and over again. So it's not just one thought of, I want to go check on the baby. I want to make sure the baby is breathing. 27 thoughts, right? With OCD, there's also compulsions. Common compulsions in this subtype of OCD are lots of baby checking. Lots of baby checking apps, which our society has a lot of now. There's diaper changing apps, sleep apps. How many bottles have the baby eaten? Staying up to make sure the baby is breathing, avoiding tasks, sending the pediatrician lots of messages in my chart, restricting their own food and drinks during pregnancy or while breastfeeding afterwards. So, a female with this type of OCD might read an article about something being harmful, and then OCD will magnify that times a million. I'm looking over at my hand sanitizer. So, uh, if there's a recommendation that women with who are pregnant avoid alcohol, right? I will have women with OCD while pregnant who will avoid using hand sanitizer because it has alcohol in it, right? Even while breastfeeding. So they'll be worried that did I drink alcohol? Did I use hand sanitizer and then it absorbed into my system? Um, Food, I'm trying to think of a food example. If they saw on the news that strawberries were recalled in New Mexico, and we don't live in New Mexico, we live in Michigan. It's a made up example, I promise. Then they might worry, what if our strawberries are contaminated? I have to get rid of anything in this house that has contaminated strawberries, even like strawberry jam that was packaged 9 months ago, right? Consequences. OCD has consequences for moms, right? Especially new moms. Exhaustion, in addition to normal exhaustion we have after having a baby, isolation, depression, panic attack. I am trained in a type of therapy called exposure with response prevention. It's considered the gold standard um, for OCD. Exposure refers to intentionally exposing yourself to things that make us anxious. So sometimes we will limit the baby checking apps. And yeah, but there is help. You can reach out to me on my website, jenlow.care. Thanks so much.